Okay, welcome. My name's Chris, I'm a physiotherapist. Today we're going to be demonstrating how to roll a resident or a client in bed. Now that's a height adjustable bed, and we're going to demonstrate step by step the procedure and the considerations that we have to take into account and generic rolling procedures. So today we've got our volunteer Kevin. Hi Kevin.
How do you do?
Good, thank you. What we're going to do today is just demonstrate step by step. So first of all, we've got to prepare the environment. So I've already prepared the environment as far as an uncluttered area. So we've removed any cords that might be tripping hazards or things to get in the road, and we've got our bed. Now we always make sure that the brakes are on the bed, so I give it a little nudge and we make sure that all the brakes are locked on. Next thing is we've got to get the bed to a workable height for the staff members. Now that's always somewhere between mid-thigh and waist, but as I'm reasonably tall, I don't always work with staff members that are the same height as me, so we have to adjust the height of the bed accordingly. Okay? Usually the taller person will have to account for the shorter person a little bit by doing a semi-squat. Now for me, the ideal height, we'll always use our mechanical assistive devices where possible, so our height adjustable beds. They're not always the quickest of beds, but we make sure that we have patience because it's a lot safer to use mechanical devices to apply force rather than our physical force. Now we always inform our client or our resident what we're going to do. So Kevin, today we're going to be rolling you on your side. So I'll give you cues and prompts as we go of where to position your hands and legs, okay?
Thank you so much.
It's ideal that we always ask Kevin to do the work for us because the more Kevin does, the less we have to do, and it encourages that re-ablement approach, which is a lot more beneficial for our resident or client function. So when we do a roll, we always want to get the hands out of the way so they don't get caught behind the body just in case. Now Kevin's preempted me a little bit, so what we do is we can always get him to cross one hand over his chest and one hand out to the side, but generally we always get clients to cross the hands over their chest because if they get to a higher level function, they will generally contract into internal rotation and flexion anyway. So it's a generic procedure that will fit the majority of a residential population. So Kevin, can you give yourself a cuddle for me? Okay. Now with the legs, we always bend one leg up because it will facilitate the roll. That's where possible. So when we're bending a leg up, we'd always ask Kevin, can you bend this leg up for me? Okay, so Kevin's really good, he's functional and cognitive. Some residents won't be that good, so when we assist, we apply the force not by grabbing the ankle, because grabbing the ankle is a risk of skin tears or bruises, and that's what we want to eliminate. So we actually facilitate on the sole of the foot, because that's the hardest skin and the lowest risk of damaging. The other hand goes behind the knee, and that's to break any resistivity or tone issues that the resident or the client may experience. So from there we facilitate, and we always come down nice and close to the load. So I'm not doing that from up around his trunk, I'm actually coming down nice and close to that body part. Now from this position we're ready to roll, okay? We'll assume it's going to be a two-person task. So I'll introduce Alicia. Okay, so Alicia's going to stand on the other side of the bed. Now within this positioning, rolling would be a two-person task. Alicia's role will be to support and guide, and my role will be to apply the force to roll. It's much safer to apply a pushing force rather than a pulling force. So Kevin, can you look towards Alicia for me? Okay, my hands will go on the hip and the shoulder, and Alicia's hands will go out ready to support and guide Kevin as he rolls. Okay, so the hand positions always go as much fingers to the roof as possible. If you can't do that for the range of your own hands, you can turn them side on, but the more downwards they turn, the increased risk of carpal tunnel syndrome. Okay, so you want to try and keep them as much pointing to the roof as possible when you apply force. And on the count of three, we're going to roll. Kevin, you ready? 1, 2, 3. Fantastic. Now you can see Kevin comes nice and close to the edge of the bed, so Alicia's got her body nice and close to prevent any anxiety from Kevin thinking he might fall off the bed, and it's an extra level of safety. This then frees up my working space, so I can apply any ADLs or apply a slide sheet or a sling or do whatever I might have to do from a working perspective. Once I'm finished, gravity will assist us as we roll Kevin back onto his back. Thank you, Kevin. And then to do the other side, it would be exactly the same but in reverse. So Kevin's still got his arms crossed. We would actually get Alicia to bend up that leg because as a worker we're not to cross the midline of a resident or a client's body. It would lose the lordosis and increase your risk of an injury. So Alicia's there, so it would be Alicia's roll on that side of the body. So legs are bent up, Alicia's ready to push, Kevin looks towards me, My hands are ready to support and guide, and Alicia counts down because she's applying the force.
1, 2, 3.
Good. I support and guide, so Alicia can fit any slings, complete any ADLs, slide sheets, whatever's required. Once we're done and ready, Kevin, we're rolling onto your back. You ready? 1, 2, 3. Brilliant. And that's rolling in bed. Please note that the demonstrations presented today are based on the majority of a residential or community client population to fit the majority of clinical presentations. If any of the demonstrations shown today do not fit your client presentations, please refer on to your local physiotherapist, occupational therapist, case manager, or alternative health professional. Thank you very much for watching and all the best with people handling.